All right. Good evening, everyone. Welcome to Our Community, Our Health, a town hall series that facilitates a two-way conversation between researchers and community members across the country. This town hall, we are focusing on the COVID-19 pandemic on top of existing U.S. epidemics and who is most affected. Our moderator and one of our speakers tonight is Dr. Linda B. Cottler, Associate Dean for Research and Dean's Professor at U.S. College of Public Health and Health Professions, and she is also the founder and director of Health Street. I am Maddie Garcia, the Marketing Communications Specialist here at Health Street. I'm now going to pass it off to Dr. Cottler to introduce you to Health Street and our other incredible speakers for this evening.
Thank you so much, Maddie. It's a great pleasure to be here tonight to talk about the pandemics over the epidemics and who's affected. We're joined here at Health Street, and Health Street, as you may know, is a community engagement program of the University of Florida to assess the community, to link the community to services, to bidirectionally talk to the community and to build trust. And we have two people tonight who are really those people who are trust builders, and we're going to hear from both of them this evening. And I want to really thank them for being with us tonight. We have Dr. Irvin PeDro Cohen, who is from Jacksonville. He is the chair of our community advisory board for our CTSA here at University of Florida. He is also the vice president for social responsibility for the First Coast Y in Jacksonville. So welcome, PeDro.
Thank you.
I also want to appreciate and thank the commissioner, City Commissioner Gigi Simmons. Commissioner Simmons works tirelessly, as does Dr. Cohen, for their communities. She is leading a group called Health Equity and Access Advisory Group, and she is trying to and has been successful at bringing services to the East Gainesville community for COVID testing. So we want to thank both of you for being with us tonight.
Thank you, Dr. Cottler.
Thank you. So we're going to start. I'm going to share my screen, and we're going to talk about this pandemic, which is on top of the epidemic. And I want to thank all of the people from Health Street who work also every day for the community. So let's start with the epidemic. So the epidemics that we see most frequently are hypertension, diabetes, stroke, drug overdose, mental illness, food insecurity, and racism. Then on top of this, in March 11th of this year, WHO declared that COVID-19 was a pandemic, a global epidemic. So on top of the epidemic issues, we now see social determinants of health disparities being more pronounced than ever before, plus increases in all of these conditions. And there are additional issues like the rising number of people who are uninsured, inadequate investment in public health infrastructure, closing hospitals in rural areas, in areas where Black people live, racial bias and discrimination in healthcare. So this has now caused these particular outcomes: stress, unemployment, hunger, social violence, and greater disparities, and what we used to call deaths of despair, deaths of disparities. So I want to show briefly the epidemics in Alachua County using the Well Florida Council data. And you can see that there are age-adjusted death rates for diabetes. And the populations that are most affected here are green, these are the Alachua Black races, and orange, which is all Florida Black races. In terms of the age-adjusted death rates for heart disease per 100,000 population also, we see that the two highest death rates for heart disease are the Blacks in Florida and Blacks in Alachua, as well as the other races here. So we see Florida whites and we see Alachua white races. This is the death rate for stroke, and we can see here the increase from 2017 to 2018 for Blacks here in Alachua County and across the state. And then in Alzheimer's disease, all populations are at risk. You can see a very high increase for Black populations in Alachua County. So when we think about the pandemic and we talk about the pandemic on top of these epidemics, we start off with the Florida numbers, that there are 574,324 people who have tested positive. And new cases as of yesterday were 5,831. And when we look at the deaths in Florida, we see from COVID, 8,685 deaths, with new deaths yesterday of 277. We look at the map here and the bubbles. The bigger the bubble and the darker the color, the worse the case load is. And we see for data for Alachua compared to Duval, we see 4,309 cases in Alachua County, 26 deaths totally. And then the case data for Duval has been 23,972 with 210 deaths. Ranging from age from 0 to 103 for both counties. We see that it's a predominantly female, 55%, 53% female. And we see that race, we see in Alachua County, 30% Black, 33% white, but 25% are unknown. We don't know what the race is. And in Duval, 33% are Black, 25% are white, 32% unknown. And we look at the ethnicity for Hispanic ethnicity with 12% in Alachua County, 28% unknown. In Duval, 8%. And 42% unknown. Now, for those of you who are joining us from elsewhere, Jacksonville is in the county of Duval. We are here in Gainesville in the county of Alachua. The CDC has prepared 3 graphs, which I want to show you right now quickly, just to show you the COVID-19 associated hospitalizations that are related to underlying medical conditions, due to maybe perhaps crowded situations or close physical contact, enclosed space, and a duration of exposure. And we can see here, if you have asthma, you are 1.5 times more likely to be hospitalized. If you have diabetes, you are 3 times more likely. If you have 2 conditions, 4.5 times more likely, and 3 or more conditions, 5 times more likely to be hospitalized. When we look at the hospitalization by age, using the 18 to 20-year comparison group, we can see that those under 18, while they're not completely immune, as we might think, to COVID-19, they do get hospitalized, but at lower rates, and they do die, but at lower rates. When we look at the likelihood as you age, as you are older, you have a higher rate of hospitalization with those 65 and older, 5, 8, 13 times more, and deaths much, much higher as you age, which the 65 and older, 90% times more likely to die, up to 630 times more likely to die. This is another issue that's really serious and we're facing right here about the factors that are increasing community spread and individual risk. And we can see these are the race, ethnicity groups, and they're being compared to population. So American Indian, Alaska Native populations are 2.8 times higher to be exposed and to test positive. They have the highest rate of hospitalization, and they have about a 1.4 times more likelihood possibility to die from COVID. When you look at Blacks and Hispanics, they have about the same case rate, and we look at hospitalizations around the same, but Blacks are more than twice as likely to die from COVID than any other race. And this could be a marker for underlying conditions that affect their health, such as socioeconomic status, access to care, increased exposure to the virus because they're frontline workers, they're essential workers, or they're critical infrastructure workers. So lastly, I just want to show what's happened with our community health worker collected data, because we can't be out talking to people out in the field. We're doing a Reconnect campaign on the phone. And we can see here the differences by race. And we can see that about 3.5%, so of the 2,200 people that we've talked with so far, our COVID positivity rate is 3.5%, about the same for Blacks and non-Blacks. Look at the high blood pressure rate, 44.5% versus 30%. And in the general population, hypertension is seen in about 1/3 of the population. So we have very high rates of high blood pressure. We have a population that has depressed mood, anxiety. We see food insecurity at higher rates in Blacks than in the non-Black population with our Health Street population. And we ask about being unemployed because of COVID, and 18% of the people we've spoken to have become unemployed because of COVID, higher rates than the other populations. They don't have internet at home, which is a problem for those, the haves and the have-nots, for those who need to school their children. But they all think that internet is very important at home. So these are other structural barriers that we have now. COVID is the #1 health concern of the populations that we've spoken to. And then in terms of stress, so there may not be as much depression in the population as you would think, 20%, but when we look at stress in the highest category of stress, there is more stress being reported by the Black population than the non-Black population. So tonight, this is our call to action. It's an opportunity for us to discuss. It's a way forward, and it's a way to talk about public health, not being only during periods of crisis. So I'm going to stop my screen share, and I'm going to turn to Dr. Cohen, who's going to talk with us about his perspectives on the epidemics and the pandemic.
So thank you, Dr. Cottler. Those were some sobering statistics, and I think as I looked at those, I started to think about some of the frontline jobs that, African Americans in particular, because that's, primarily the group that I work with, who are, that they work. And in doing some research, I found that, most African Americans, about 30% of the population of working African Americans, hold jobs as caregivers, cashiers, sanitation workers, and public transit workers. And if you think about those in its aggregate, those are the people that are on the front lines of this COVID epidemic. And if you layer that onto, those are the jobs that are most vulnerable in terms of not being able to miss work. So those people have to be to work no matter what. And they are the most likely to be fired if they're not there. And so you add that onto the stress levels that are associated with COVID-19 and some of the implications that it has there, then you find yourself dealing with, a high volume of people in this instance. I think if you go back and look at the numbers, I think African Americans constitute about 42% of the deaths associated with COVID and about 33% of the hospitalizations associated with COVID. And I think the one thing that we don't take into consideration when we're thinking about this whole instance is the impact racism has as a disease state relative to all of our healthcare processes.
That's right. So by the way, this is being recorded because there are a number of people who are going to be watching this at another time. And so we appreciate the discussions that we have tonight, and also the additional discussions that people will be having in their classes. Commissioner Simmons? you have some slides, and Maddie, if you could.
Yeah, of course. Just give me one moment.
Mhm. Dr. Cottler, while Maddie start that, before she start, I just wanted to echo everything that Dr. Cohen said. I agree with you wholeheartedly. And what COVID has done, it has shown that it has magnified the inequity in our communities. So I just agree with everything that you said and how racism plays a major role in this. So the first slide that we're looking at is just some data that I received from the Alachua County Health Department, the Florida Health Department website, and Dr. Cottler, she went over that as well. So I don't have to really go through each box, but I just wanted to highlight that within Alachua County, if you look where it says race, 1,265 or either 30% of African Americans or Black Americans have or been tested have been tested positive for COVID-19, and we only represent 20% of the population within the county. So I just really wanted to highlight that particular number to show you the disparity and inequity within Alachua County as relates to the positivity rate in COVID-19. So you can go to the next slide. And so as the District 1 Commissioner, what I wanted to do is really reach out to particularly my district, which is East Gainesville. And East Gainesville is composed of a majority of African Americans in Alachua County within the city of Gainesville. And as I just stated earlier, COVID-19 has hit us the most, had hit us the hardest. And one thing that I realized as the pandemic was getting further along throughout the year is that we did not have enough, in my opinion, we were not marketing to the vulnerable population. We were not getting the word out. We did not have, in my opinion, adequate testing sites. People just did not know where to go. And early on, I think because you needed to have a doctor's note, you needed to have symptoms, and locations were not in the heart of District 1, not in East Gainesville, where people could actually go and get tested. And as you all know, my colleagues here, access to healthcare is non-existent to majority of Black Americans and Black Americans. And so it was very difficult for the residents in Alachua County, particularly in East Gainesville, to get tested. And so what I did is I reached out to the North Central Florida Community Foundation and partnered with them to apply for a grant with the Walmart Foundation. And in doing so, we received that grant. And in that grant, we were very specific that we wanted to reach out and touch East Gainesville residents. And because of that initial onset with Walmart Foundation, we were able to partner not only with the Community Foundation, but also with Dr. Cottler and Health Street family, the health department, Dr. Grant Harrell and his team, the students actually did the testing. And so we received $25,000 from the Walmart Foundation. And because of that grant, we were able to test over 1,300 residents in East Gainesville at our MLK Center, which is located off of Northeast 8th and Waldo Road. We were also able to give out face masks for the children that's going back to school, and also for adults, hand sanitizer. But most importantly, what we did, we provided a place where people can have access and come and get tested. We also provided the PPE equipment to the folks, but most importantly, we provided literature, which was so important. We gave out goodie bags with literature, showing not only just in writing, but in detail in pictures, showing our multi-generational families how to refrain from the vulnerable, your grandmother or your grandfather, if you're in a house together. So it was so important that we hit the multi-generational families, because we understand our children have to go back to school at some point, and we wanted to make sure that that our vulnerable population was safe. And so with that initiative, I believe we brought a sense of security, just to know that, hey, I went out and I got tested, just to bring that sense of security to our residents at East Gainesville. So I'm very pleased with that. And also, as Dr. Cottler mentioned earlier, she and I and several other stakeholders in the community have been working together to looking at ways that we can provide access to healthcare, not just in East Gainesville, but also in Eastern Alachua County. And so what we do know, and I think the data has proven it time and time again, that the inequities exist between Black and white. The disparities are now more so than ever have been highlighted, and that equal access to healthcare has been non-existent. And so as a city official and as someone in government, I believe it's my job and my role to take that step in providing and at least leading the way in trying to assist our vulnerable population to access to health care.
That's right. I wanted to ask you a question, Commissioner Simmons, about the responsibility of people to tell us what the numbers are. And as you recall in the beginning, we didn't know what the racial breakdown was of the people who were being tested. We didn't know the breakdown of people who were testing positive. And talk a little bit about what you did in order to bring that to the attention of the people who needed to do it, and then how it became something that was part of their standardized testing results.
Sure, Dr. Cottler, and you're absolutely right. In the beginning, we didn't know anything. We didn't know the breakdown. We didn't know what population was tested positive. If for us, the Black population versus Caucasian, we didn't know the age group. We didn't even know the gender. And I think that was a concern, not just for me, but for the group that we sat in on, is how are we going to help the community? And we don't even know who to help. We don't even know where to go. And so in the beginning, it was like pulling teeth from the state, wanting to get that information. And we felt as though that it should have been made public, because it deals with the public, and we should be able to be able to help, and should be able to have some type of direction in who we help and how we help. And so I reached out to the state of Florida, the director, Paul Myers, here in Alachua County, and had a conversation with him. And I believe because of some issues he had at the state level, it was kind of contentious in the beginning. But I reached out to him again, and I reached out to my counterparts with the county and said, this is important to me. This is important to the community. If the African Americans or Black residents in my district or in this city are dying at a higher rate or being tested positive and nothing has been done, then we are not doing our jobs as city officials and servants of the residents in this community in protecting them. And so with some help from some county officials reaching out, as well as myself reaching out to Paul Myers and explaining to him how important this information is and how we need to know, he changed his mind. I'm just going to say that. Right. He changed his mind. And because of that, we were able to get the data and start aggressively marketing in these areas, in these communities, vulnerable neighborhoods, and getting that information out. And once we realized the impact that COVID truly was having in the Black community, we were able to do door-to-door, door hangers, and pretty much get the CDC guidelines and get information and put it in and package it where those members of a community can understand it.
Dr. Cohen, can you talk about conscious bias and what role that bias can play in progress and in really understanding numbers and understanding how to protect one another?
Sure. Well, I think conscious bias early on played a part in who got tested. Here in Duval County, there was mass testing, but you had to have a car.
Right.
And you had to wait inside your car in order to be tested. You could also get tested if you were willing to shell out $150, which was to be reimbursed to you by your insurance company. If you lived in a suburban community or out at the beach, testing was available for you early on in the process. So I think just by virtue of who had access to testing played a part in terms of conscious biasness. And that conscious bias says that these are the barriers that we're going to place in front of you for you to be tested. And also, I think one of the things that we, failed to sort of recognize is once you're tested, what happens then? What happens when you find out you're positive and you have to be quarantined for 14 days? As I stated earlier, when you think about the vulnerable jobs that people of color, 30% of the population have, healthcare workers, caregivers, service workers. So you can't afford to be off for 14 days. So that conscious biasness plays a huge part in people not wanting to get tested. So I think that we have to look at all of those things, and particularly rapid testing. Those very same people can't afford to wait for 2 weeks in terms of testing turnaround to be told that, oh, congratulations, you wind up being not positive. But in the process, you've missed 14 days worth of work. And so I think that we have to look at all of those things and put processes in place that allow rapid testing to be a part of the mix without it costing $150 for a person who's making, less than $1,000 a month to play. That's a big part of their income. And so I think we have to do all of those things and put a system in place that allows people access, that allows people rapid testing to get the information back, and a process that gets them back to their place of employment in a very quick manner.
And then there's unconscious bias too. Those are the things that some people don't even know that they are biased.
Right.
And I think that pans out if we look at the deaths, not only of COVID-19, but we look at the deaths associated with a number of things. Black women die in childbirth more than any other race of people in our country. That it may not be biased when you walk into the office, but when you look at the numbers of women that die in childbirth, that says something is wrong about our system, and we have to be prepared, or we have to be at least willing to not only acknowledge it, but once you acknowledge it, be prepared to do something about it. I think we are at a point now where we're acknowledging our healthcare system has a problem, but what are we prepared to do about it?
So this is really great, and actually goes in with a question that a community member sent in. So they asked, how do we address conscious bias, and then how do we hold each other accountable or for our conscious bias? So if either of you want to comment on that.
Sure, go ahead, Commissioner Simmons.
Well, I think what we're doing now at some point is addressing it. I think COVID, again, it just took the blanket off the inequities in healthcare in our community, not just healthcare, but other things in our community. Having these round tables, having that conversation. I know for me within the city government, We went to our EEO office and we said, hey, we need to make sure that the people, that our workers, that our staff, that people within the city understand race, understand biases, understand the relationships and the role that they play. And we are beginning to start holding within the city. We're holding people accountable. You know, we're going through training. We're going through, we're working now with a racial equity toolkit. Every project that we have, everything as it relates to our community, we put it through that racial equity toolkit. And we're holding, we have put forward a substantial amount of money to it within our city staff and within our government to make sure that we understand biases, we understand racial inequity, and we're actually not just talking the talk, but we're walking the walk. We're putting our money where our mouth is, and we're making sure that we're training our folks to address those issues.
And I would agree with you. We are at a very interesting time in our country particularly, as COVID has taken the lid off of inequities across the board. Not only are people having conversations, but I'm seeing them venture into areas that traditionally they have not been, they were never comfortable venturing into in terms of discussions of injustices across the board. And so at the very least, we're having a conversation. Mm-hmm. But what happens when, when we get a vaccine for COVID and, the level of acrimony and racial tension is not there? But I think I'm hopeful that we're in a good space. We're at least having some dialogue, and that dialogue will lead to subsequent action.
Yeah. Dr. Cohen, there's a question for you here. How has COVID-19 impacted Jacksonville neighborhoods that you work with, and what are you doing to combat that?
Well, I mean, I think the impact has been consistent across the board. The first thing we had to do was really bring testing period to the neighborhoods that I serve. And I want to thank you, Dr. Cottler, because from our initial conversation around testing, that next morning, I got a call, and within 48 hours, we were having we had set up a testing location at one of the branches that I represent. So, I want to believe that you had a lot to do with that, but I think that was the first step that we did. And I think, that's just one step. I think we have to be prepared to address some of the inequities that exist in communities of color. Grocery stores, no access to adequate healthcare systems. And when I say systems, I'm talking about doctors' offices. So those are the things that we are at least trying to address on a systems change basis, rather than, saying, hey, we got COVID testing and that's it. But if you don't have access to adequate healthcare, if you don't have access to, fresh fruits and vegetables in your community, and I'm not talking, and as much as I appreciate the food bank, I'm talking about something more long-term and long-standing. The food banks are great, and they do a wonderful job, and they've done an outstanding job at this time of need. But I'm talking about grocery stores in these very vulnerable communities. They deserve them. If you could put 5 or 10 in a community of resources, you could at least put 1 or 2 in those vulnerable populations. So I think that that's one piece of it. And again, getting people access to adequate healthcare, and that means healthcare systems having a vested role. One of the things that we did within our organization is we partnered with hospitals across the board. Our new facility is going up, and we're partnering with UF Health, that people from outside of the community will be able to come into those facilities and have access to at least a nurse without having to pay a cent. And I think opportunities like that are at least the first steps in making healthcare available to all people.
Wow.
That's great.
That's amazing. Food, hunger.
Right.
Could be a cause of violence.
Yeah.
You
Right.
see on the news that in Florida, farmers are destroying things because they aren't, for whatever reason. I mean, why can't that food get given to people in need? Because when you're hungry, when you're hot, when you don't have air conditioning, when you don't have the means to get what you need, it causes a lot of commotion, potential violence. And it's a simple, seems like a simple thing to fix. So Commissioner Simmons, when will you be fixing that?
You know what?
Fixing
Let me,
farming is a good thing.
Dr. Cottler, I think we have to have an infrastructure in place. And I think that's what's missing when we talk about that food desert, and we talk about the farmers and getting that vegetables and those fresh produce to our vulnerable population. I believe that we lack the infrastructure. When I talk about infrastructure, I'm not just speaking about sidewalks and a street. I'm talking about an actual infrastructure where we as a government have something in place, where we have something, a partnership or a relationship. We have built something and have maybe set aside some incentives to put or package something together to attract that type of food vendor or farmer. And I think that's what we're lacking. And until we can come up with a strategy and an actual infrastructure and have that in place and build those relationships, you're just going to continue to get the remnants. And that's not what we're wanting. And that's what I'm hearing Dr. Cohen say. We need something that's more stable. We need something that will be a success, but we have to have an infrastructure in place.
You know, and you know, I would say that, you know, when I look at that, you know, not only do grocers have to be brought to the table, but the implications of when you close down a grocery store in a challenged community, these are the implications of that happening. So not only do grocers have to be to the table, hospital people have to be to the table, or healthcare people have to be to the table. People who understand crime and violence have to be at the table. Educators have to be at the table. I think what we have done as a society is we have commoditized every single aspect of our lives. And within that, there are vulnerable communities, and they don't make as much money as other communities. So what happens is the commodification of human services says that, hey, if you as a household don't make $100,000 a year, guess what? We're not going to give you a grocery store. Well, the fact of not having a grocery store has downstream implications that I think that we have literally discounted. And those discounts lead to children failing out of school, people having worse health conditions than they've had ever in our lifetime. And I think that's the thing that we have to get back to, because we had grocery stores in all communities at one point. And the question for me is, why don't we have them now? And it goes back to the commodification of people.
And if I could just add one thing, and Dr. Cohen, what we're dealing with now is unintended consequences. And that's what the equity toolkit speak about, the racial equity toolkit, because everything you just said, everything that you just mentioned is we are facing the unintended consequences of those actions.
Right.
And I would say that that's one of the things Commissioner Simmons is really working on. She is really working for access to healthcare, access to food, and it may be a one-stop shop. You may go in there and get your food at the same place where you're going to get your care, but something has to give, and we all have to call to action to help her to make that reality.
Yes.
And I think that, you know, we are, you know, I'm hopeful again, because now it's not just vulnerable populations saying that this is unjust. You got people who have means and the capacity to literally push change, saying, you know what, I agree with you. This is pretty unjust. And they are committed to doing something about it. And I think that we have to continue to identify those people. lift them up and give them, you know, sort of the political protection to push through the change that we want to see.
So actually that brings up a really great question. This one's for Dr. Cottler from a community member. As the only non-Black or African-American speaker this evening, what is your plan of action when people are saying reading and learning is no longer enough? And I guess it's a two-part. How are you going to use your influence to create change at the law level?
At the what level?
Law level.
The LAW?
Yep. So I think like, yeah.
Well, our job as people with white privilege, as people with education privilege, our job is to use the information that we have to help as many people as we possibly can in whatever system that we can. So there are people who work with the criminal justice system to try to be more equitable. There are people who work with the police system, and whether it's in Gainesville, St. Louis, or whatever, to work to try to find ways to make sure that the police officers are being trained properly, so that there is there's knowledge base, and that they get bias training, and that we can hold people accountable. It's also one of the things that we can do with our academic background is to try to write the grants that we can get to help to bring services to communities on a sustainable basis, and to work with the leadership of our institutions to bring the lens of the community to them, to give people you know, bi-directionally to hear people and help them to speak with their voice, so that it's not just, you know, a tipping where just the one population gets all of the services. So we all have a part to play, and our part is to also disseminate information so that we can make policy changes and help. That's what, I mean, personally, I try to do, is to just help Dr. Cohen, Commissioner Simmons, in whatever ways that we can, to give them the ammunition that they need, and to give more equity, to have more equity for populations. We also have to speak up when we see things that aren't right. That's the thing that I really worry about, is that, for example, on a call the other day, there was someone brought up the fact, did you know that there's no woman on this committee, blah, 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 or did you know this or that? I mean, it wasn't a woman who spoke up, because it's very hard for a woman to say you don't have a woman on your committee, but it was a man who spoke up. In the same way, when there are inequities, it's our responsibility to speak up, to have a voice, that the Commissioner Simmons and the PeDro Cohens don't have to be the only ones all the time bringing these issues to the table.
And one of those, I think one of the things that we also have to do is use our proximity, what I like to call proximity reciprocity, to create access. You know, those who have the greatest capacity to change an issue are those that are closest to the issue, but they don't generally have the proximity to those people in power. And so those of us who have proximity reciprocity have to create access for those that are closest to the issue. Because at the end of the day, I'm going to go home to a community that does have a grocery store, but I have to not be afraid to use my voice to advocate for those people who don't. And, you know, it's not good enough for me to have access and say, well, you should work hard and you can live where you got grocery stores. That's no longer good enough. And I think in this process that, you know, we are literally seeing the tectonic plate shift below our feet, where we are moving from people being simple allies to people being accomplices. And that's what I think we need to start to develop more accomplices, because accomplices, in my opinion, have a stake in the equity gain. And that equity gain doesn't necessarily mean that I want to see everything equal, but we need to talk about what is going to be the standard. And if we could create a simple standard, that standard will say that all communities will have at least one hospital, all communities will have at least one grocery store, and push our legislators to make sure that that happens. Because I can assure you that those at the top of the pyramid in terms of influence and power are making sure that it doesn't necessarily happen because it don't impact them.
Commissioner Simmons?
I just agree. And for me, it's grassroots. You have to be where the inequity is. You have to have your ear to the ground. You have to have those relationships with the vulnerable population. And you have to build partnerships. You can't do it by yourself. And you have to be that bridge and be able to articulate the needs of the community to that institution or to that hospital, to the government, because it's critical. It's so critical that the person who has the political will fully understand what their cohorts or what their constituents are going through and can be able to articulate that, because it has to, you're voting. And so you have to be able to convince, you have to be able to talk and have dialogue and make sure that you're getting their needs across, because that's what it's all about. And you need those partnerships. And I can't say that enough. It's all about the partnerships.
There's another question for you, Commissioner. What do you see as the most positive thing that's happening right now to reduce inequities in East Gainesville?
What I love so much about the time that we're in is that we have a very diverse commission. This is the most diverse commission that I believe that's ever sat on the commission. And that's a testament to where we are as a community. And the direction that we are going as a commission is so focused in East Gainesville. We have set aside almost close to $3 million in on 8th Avenue, Northeast 8th Avenue, at one of our community centers. We have a Unity Park that's getting ready to be built in off of Northeast 15th Street in East Gainesville. And I know those are parks, but those are just some examples that the commission has pledged to reinvest or to invest in those neighborhoods. And so it's a start, and I think that's a positive start. I've spoken with 2 business owners in East Gainesville, and they're just so excited about the change that they're seeing. And I think we've also have new economic development taking place in East Gainesville. And so I think from my point of view, what's so positive right now is that, from what I can see, is that you have a concerted effort from a commission that really wants to see great things happen in East Gainesville. And so when you have that type of vibe, if you will, if you have that type of consensus, and it's all positive, it can only get better from there. But from right now, I'm seeing a lot of positive things take place in East Gainesville. We're not there yet. It's not going to happen overnight. It's not, and it's very challenging. But thus far, you have a commission that's committed to development and seeing great things happen in East Gainesville.
Is there any last words that you'd like to share? Dr. Cohen first.
Well, I just would like to say thank you for inviting me to be a part of the process today. And every time we have conversations like this, and when I say we, I'm talking about the collective, it removes a layer of willful ignorance on the part of people who simply say they don't know. Well, when you are part of conversations like this, you can no longer say you don't know. And I live by a principle of you can't unknow what you know, and you can't unsee what you've seen, and you can't unthink what you've thought. And so this process for many people now empowers them with the capacity to know. And once you know, you are obligated to do something about it. And so I appreciate any opportunity to not only share my knowledge with the masses, but to gain knowledge from people that's part of the process as well. And so Commissioner Simmons, thank you for your wisdom. Dr. Cottler, thank you for sharing with me today. And hopefully we have empowered somebody through this process to be able to go out and make a difference in the world and be the change they want to see.
Thank you. Commissioner Simmons?
Thank you, Dr. Cottler. I just want to thank you so much for putting this together. This has been a great experience for me. And Dr. Cottler, it's been a pleasure meeting you. And I'm looking forward to working with you at some point in the near future. I just want to say that, that people of color have always needed and deserve equal access to healthcare. And as we continue to move forward in this COVID era, and as COVID has again shown us the inequities and the disparities in our communities, I am hoping that there's a light at the end of the tunnel with this pandemic. And that light at the end of the tunnel is that we wake up as a community and as a society, and we do what's right for all of our neighbors, all of our residents, all of our citizens in this community and in this country, actually. People of color are deserving. People of color should not be marginalized. We're all human beings, and we all deserve what's best. And what I'm wanting to do and what I will continue to do is continue to advocate for equity. I will continue to advocate for for people that look like me and others, but more so for the marginalized people in our community. I will use my voice and my platform to make sure that I do the best that I can possibly do to make sure that people have access to not just healthcare, but food, housing. That's where my passion is. That's what I'm wanting to do. And Dr. Cottler, let me just say this. I'm not saying this because I'm not up for re-election. So I'm not I'm not campaigning, if you will. I'm just simply stating that marginalized people of color, inequity, injustice, discrimination, racism has no place in this community. And so I'm willing to work with you all, anybody that wants to make a difference and a change in this community. I'm here. So again, I just thank you so much, Dr. Cottler, for giving me this opportunity to use this platform. And I look forward to working with you all in the near future in some capacity. Thank you.
Thank you very much, both of you. It's sobering to be on a call with you both and to hear the things that you're doing and that you've done. It's an honor and it's a privilege, and I thank you. I wanted to thank Maddie Garcia for putting this together. And for doing the hard work that it takes to do OCOH, to do the recording, to send it out to people afterwards from here who are going to hear us. And I want to thank everyone for joining us in this evening. This pandemic on top of epidemics. Thank you for listening, and let's be interested, look for additional opportunities to continue. And remember, we're not perfect, but we're trying. And during this time, there are people who don't think the same way that we do. So when we're trying to reach common ground, we have to not assume negative intent, but express our understanding for the person's situation that they may be in. And then explain to them why the conversation matters, why it's so important that everyone should have the opportunity to do what it is that they want to do, as Dr. Cohen said and as Commissioner Simmons said. So I just wanted to say thank you again and be well.
Thank you all for joining us for this wonderful OCOH. Dr. Cohen and Commissioner Simmons and Dr. Cottler, very wonderful discussion. And we look forward to sharing it with everybody. Feel free to connect with us on Facebook at UF Health Street, as well as Twitter, the handle at UF Health Street. And then of course, we will be posting this within the next 48 hours on our website. So if there's anyone that you know you want to share this with, please do. Thank you, everyone. Have a good night.
Thank you very much. Have a good night.